Welcome to this short presentation about an overview of non-Meiri cystourethrography. Here we have in summary what we are going to talk about. We have the review about the anatomy. We have the retrograde study. We have examination of the urinary bladder. We have antegrade study, and we have combined retrograde and antegrade studies. Cystourethrography combines the uretrography and cystography. Uretrography is a radiographic study of the urethra. Cystography is a radiographic study of the urinary bladder. We have many indications of cystourethrography. For example, we have pelvic trauma in the emergency department. In this case, retrograde study can be performed only when there is straining, dribbling urinary stream, when there is suspicion of urethro-diverticular, urethral obstruction, suspected urethral foreign bodies, urethral mucosa tumors, suspected urethral fistula, suspected bladder injuries, congenital abnormalities of the bladder and urethra, a suspicion of vesicoureteric reflux, when also there is a suspicion of urethral strictures, you can recommend a CUG or URETHROGRAPHY. This is the record of the anatomy. We have primarily the four parts of the urethra. We have penile urethra, we have a bulbar or bulbous urethra, we have membranous urethra, we have prostatic urethra, and here we have the urinary bladder. The most anteriorly to the penile urethra, we have fossa navicularis, where we dilate our Foley catheter so that we may push the contrast medium and perform retrograde and filling of the bladder. So we have many views which can be used. We have AP for preliminary and post-void scout images. This patient is in a supine position, and it is for a preliminary and post-void scout image. And here we have right posterior oblique and left posterior oblique, which are recommended for retrograde and antegrade series. So we have many steps we have to follow when performing a CUG. First of all, you have to explain to the patient about the procedure and the possible complications. You have to position the patient in a supine for preliminary scout image, position the patient in right posterior oblique or left posterior oblique for retrograde study, clean the penis using antiseptics and gauzes, cover the patient properly for patient privacy, dilate the Foley catheter in fossa navicularis only in adults, not performed in pediatric cases, connect the syringe containing the contrast medium to the Foley catheter, push slowly the contrast medium under fluoroscopic examination. Take image of opacified urethra with refilling of the bladder. This is the retrograde study. So fill the urinary bladder with normal saline and contrast medium via Foley catheter dilated in the fossa navicularis, or via ASPC for suprapubic catheter for the patients who have it. Take the images of the bladder in the AP, lateral, and oblique positions. to rule out any diverticular. Position again the patient in right posterior or left posterior for antegrade study. Ask the patient to urinate under the horoscopic examination. At this time, you will have focus on the urethra, and you will also have focus on areas of the ureters to check if there is no vascular-ureteric reflux when the patient is pushing. Ask the patient to empty the bladder, then take a post-void image in supine to check if there is no significant PVR. So we need many equipments. We will need gauzes, antiseptics for cleaning the patient. We will need medical drops, sterile towels for patient covering. We will need jelly, lubricant for softening the foray catheter. We will need contrast medium. We will need foray catheter size to 12-14 for adults and 6-8 for pediatric patients. And we will need normal sign for filling the bladder. You will need U-shaped or kidney dish. You will use the syringe of 5 mils for ballooning the foray catheter in fossa navicularis, and big syringe of 60 mils for filling of the bladder and injection of contrast medium. And of course, you will need sterile gloves and a fluoroscopy machine and surgical forceps for clamping of foray catheter. So before pushing the contrast medium, you will need to take a preliminary scout image. The purpose is to rule out any pre-existing pathology, abnormal calcifications, to outline of some masses. You can even see the pathologies of the bones. Here we have preliminary scout images showing the pelvis. This image shows no pathologies. So after positioning the patient in the right posterior or left posterior obliques, and after inserting the foray catheter and dilating it in fossa navicularis, you will push slowly the contrast medium under fluoroscopic examination. You can see how the urethra is very well opacified, primarily the anterior urethra, and posterior urethra will be visualized very well during the antegrade series or micturating series or voiding series or descending series. After performing the retrograde study, you will need to feed the bladder at the maximum and for the assessment of the bladder injury, to rule out congenital abnormalities of the bladder, throughout diverticular bladder tumors, vascular-ureteric reflux, and features of cystitis. Here we have the full bladder in AEP view. You can see that the inner surface of the bladder is smooth and regular. You can see no diverticular. On this lateral view, you can see that the bladder walls, they are smooth and regular, no trabeculations, no diverticular, and you can see there is no, in the areas of ureters, there is no vascular-ureteric reflux. You can see any filling defect. So antegrade or uretrography or descending uretrography or micturating uretrography, it is done when the bladder is full maximum, You remove the foray catheter dilated in the fossa navicularis, and you request the patient to micturate under fluoroscopic examination. Here we have the urinary bladder. You can see the patient is micturating, and you can see that the posterior urethra, prostatic and membranous are very visualized. And finally, when there is a total or complete obstruction, you will need to combine retrograde and antegrade studies. Here we have the case of the patient with complete stricture. It's a segmental stricture. For retrograde, you will balloon the foray catheter in the fossa navicularis, and you will push slowly the contrast medium. And at this level, you can see that there is an area of blockage. At this time, as you have started with retrograde, you cannot know that it is a ring-like or segmental or stricture. So you will need to fill the bladder via suprapubic catheter, and after filling the bladder, you will ask the patient to micturate, and you will push again the contrast medium via foray catheter dilated in fossa navicularis, and you will ask the patient to urinate. You can see the contrast medium is going down, and at this area it is stopped, and another one pushed upward, it is stopped at this area, and you can see that there is a segmental stricture. So if this contrast medium continues downwards and reaches at this point, you will conclude that there is a complete ring-like stricture. So thank you for your kind attention. For further reading about this topic, cystourethrography, you can also read about female cystourethrography, and you can read about the pathologies seen in cystourethrography examination.